Okay, our next guest is Dr. David Minkoff, who will reveal what most people never hear about the true cause of plaque development and a lesser-known test used to detect excess buildup before it's too late. Are you taking a statin drug to protect your heart? Then find out why the idea of managing your cholesterol could be one of the biggest mistakes you'll ever make. Plus, you'll discover which hormone is a must for healthy heart function and why conventional drug therapies can put you at risk for a deadly deficiency. Enjoy this valuable presentation with Dr. David Minkoff. So no doubt, nobody wants to see a lot of arterial plaque inside of them, so everybody gets that. But let's talk a little bit for a few minutes here about what's causing the arterial plaque to build up inside somebody's body.
Okay. So plaque is the end result of an inflammatory process. So inflammation sort of traditionally is heat, redness, swelling, pain, okay? So if you get inflammation in your arm, it's red, it hurts, it's swollen, it gets congested. The inner lining of your blood vessel system can get inflamed. And the things that we addressed earlier, like homocysteine and insulin and glucose and lead and arsenic and mercury and lipopolysaccharides and gut bacteria, can get into the artery wall and cause inflammation. And so the body responds to that particle because it's foreign, it's not wanted, and it wants to get rid of it or contain it or kill it. And so you get an acute process, but then as it calms down, you get scarring and you get calcium deposits and you get cholesterol deposits, and the body forms kind of a Band-Aid over the area where the inflammation was. Now, a heart artery isn't very big, maybe a little bit bigger than a pencil lead. And when you have recurrent injury to that artery, and usually it's in areas where there's high flow, so you don't really see plaque in veins very often because the flow is low. But you get this inflammation and then high flow from the heart pumping, and then you get buildup. And then you get injury and a coating, and injury and a coating. And as that artery narrows and narrows and narrows, some of it is sort of solid, calcified, isn't moving, stable. But the new layers are soft. This is called soft plaque. And the soft plaque is probably the most dangerous because with shear forces from pressure, it can rip off or it can tear. And with the tear, you get new inflammation. So the body sends in their platelets, and fibrinogen and these other factors, and you get a clot, and then the person has a heart attack, or they have a stroke, and then they got a problem. So that's where plaque comes from, and that's what happens, and that's what we don't want. Now, as this occurs in other arteries, we get stiffness everywhere. So the arteries get stiff. We have a device in our office where on every new patient we screen them. It's a device that will detect artery stiffness. Now, young children and babies, their arteries are just beautiful. They're flexible, and they contract, and they're just wonderful. But as people age, and as the inner lining gets more and more injured, and it scars more and more, you get stiffening. They call it hardening of the arteries. You get calcium deposits. They almost turn into bones in some people. Like you do an autopsy on someone, or you do an x-ray, and the artery is calcified like a bone. It no longer contracts. It's like a bone. And that's what we don't want.
It amazes me how often people are just taught only the simplest, most dumbed-down version of what you talked about. It's like everything you described as I was listening to you, I thought almost as if arterial plaque is really the cause or the thing that happens because of blood disease. It's like your blood is so toxic from everything that we talked about in Module 1, people should really listen carefully to all the things that cause inflammation, all the things that people should be paying attention to that make the blood so toxic and it's pouring in there and it's causing all these injuries that then this plaque has to come in to try to help the body to survive.
Right, right. It's a body defense mechanism. It's trying to fix a problem. And unfortunately, you can't fix a problem by not addressing the problem. So if we're trying to unwind this, then we have to just go back. Like, what are the things that are doing it? Can we stop that?
And before we get into the testing, just to be very clear about what's going on here so that hopefully people take it very seriously, most of the time, most of the people out there being well treated, as conventional cardiology would say, or well managed, taking the medications, keeping their blood pressure down because of that, keeping their cholesterol down because of that, the plaque keeps building. And then, like you say, with the blood flow, isn't it true that in most cases, these heart attacks, it is the tearing away of that plaque, bam, and that's what does the person in. And these are the people who are well managed and well treated that this is happening to.
Right. And I think that's why conventional treatment doesn't really extend lifespan in mostly when it's looked at, because the process is still continuing and the management of it isn't really getting to the reason why this recurrent and constant injury is occurring.
So let's talk a little bit about the testing. You mentioned, again, just mentioned the name of that test that goes around the arm. It sounds so simple, painless, and amazing. Talk about that again for a moment. But are there other things that you can do to test with your patients to reveal to them, hey, you've got something going on here. This plaque is building up.
Right. So this is a device which measures artery wall flexibility. And it's an easy test. We have another one that you can actually put it on your finger, and it tests the pulse wave in the finger. And from the pulse wave, you can tell, is the heart under strain? Is there artery wall thickness? And it can give you feedback. So if you're looking at people like this, and you know your score ought to be 9 and you're a 3, you know something's going on. Many doctors will do a CT scan of the heart looking for calcium deposits, okay? Calcium deposits in the heart go with coronary artery calcification, which is inflammation. So if you have a high score, you may have artery disease that's significant. In people who are symptomatic, you know, like I'm having trouble getting upstairs or my legs are getting crampy when I walk, I may send them for an echocardiogram and a stress test. It's called an echo stress test, where they do it at the same time, where they test them to see, can their heart actually pump normally and get blood flow to it, or are they going to get symptomatic, like they get some chest pain or their cardiogram shows strain? That's another way to try to look and see where are you in this process.
This whole thing, Dr. Minkoff, is about really raising awareness. That's why I appreciate so much your time. Most people, like we've been saying already, they don't know that their heart, all their plumbing is breaking down in too many cases until it's too late. Conventionally speaking, looking at some of the therapies now, taking statins, blood thinners, the stents, the bypasses, for me personally, it's very stressful, way too late, these kind of things. But talk to people about maybe some of the things that they haven't heard about that might be dangerous. Like, let's just take statins, and as people are on them for a while, what can happen to those people that maybe they're not aware of this?
Yeah, I mean, there's a lot of statins being delved out. And actually, we don't use statins at all, except in some cases of people who have cancer, because sometimes it helps with cancer. But statins for cardiovascular disease just don't have a track record that really makes a difference. And side effects from statins, you can get liver inflammation, the increased incidence of liver cancer, you can get premature dementia, you can precipitate diabetes. So these are not nothing drugs. Some people, even on low doses, will get muscle pain or muscle cramping. So I don't want to manage cholesterol as my primary thing with cardiovascular disease because, again, half the people with heart disease have normal cholesterols. The other thing is LDL is sort of the target particle. It's the LDL cholesterol. It's sort of the bad cholesterol. Is the target particle for most of the statin drugs. And cardiologists now want that LDL as low as they can get it. For sure under 100. The norms were all reset. So sure under 100. A recent study in the British Medical Journal looked at 39,000 men, 60 and up, and found that the higher their LDL, the longer they lived. So when there's this much confusion, you know you don't have the right answer. And so that's why on the medication side, I usually have people reduce and go off because I'm afraid of the side effects. And I know that if I repair the other things, they're going to do better.
I know with my exercise physiology background and doing a lot of athletic training and working with the average person years ago, that it seemed like 12 to 18 months out, that's all it was, that from taking statins that long or longer, it was so hard for these people to get going. And when they did move, they were more sore, they complained of pains. Here it is, we throw around, these people should have the willpower to exercise to reduce their risk of cardiovascular disease, but they're throwing the drugs in them, and it's literally making it difficult for them to move.
Right. The other problem with this is that statins can reduce cholesterol, which then reduces testosterone. And testosterone and cardiovascular is like really important. The heart has more receptors for testosterone than any organ. It's a muscle. And testosterone levels are very important in people with heart disease. So I try to keep their testosterone levels high. Many people on statins have low testosterones because they have low cholesterols. You know, the drug will be given and their cholesterol will be 130 or 125, and the cardiologist couldn't be happier. And then their testosterone is running in the 200s or 250s. And I want them in the 800 and 900 range because that's the best for their heart and it's the best for their morale and it's the best for their weight. And you know, you can't, it's not the right thing.
Right, I didn't, hopefully we're not losing people, that we're going off into left field, but where you're going with this, in treating arterial plaque and pumping people up with statins, and we see this loss of will to live, like the passion, you know what I mean? Not the, I want to kill myself, God forbid, but this passion thing, especially in men, as you're saying, with the testosterone dropping, and people want to know what's going on with this person. They just seem to lackluster and they don't have this strong desire and passion anymore. This is what you're explaining. Like their testosterone levels are dropping, it's affecting their personality.
Right, right. So not good medicine in my opinion.
So let's talk about blood thinners, right? That's got to be a biggie too. You're getting all this sticky stuff inside. We got to keep your blood thin. But what are people not hearing about blood thinners?
Well, anyone who's gotten a stent has a mandatory 1 year on Plavix or one of the similar drugs. Okay? Now, the problem with the stents is about 20 to 25% of the time, within 6 months, they're going to clot. So they put material inside to block clotting. They put people on blood thinners so that they don't clot. And so they have side effects too. And there can be a danger. You fall down, you bang your head, you're on a blood thinner, you can bleed. So, I'm not telling people who just had a stent not to take their blood thinner for a year, because I don't think that's right either. If you're going down that road, you kind of got to go with the cardiologist until you're stable on it. We're going to work on lifestyle change, but I'm not going to change that right at the beginning.
No, and not to confuse people, but we want to really sound the alarm about how urgent this is to measure how healthy are your arteries before, God forbid, you need to have a stent. Because like what you said, now you're putting a device in there, it raises the risk of infection, but it's in your body. And I mean, all these things, it's a little too late at that point almost to just want to do everything holistic. Let's be really clear about this stuff before we need to get a stent.
Right. And I think sound the alarm's really right. Because the thing that's most likely to kill your average person walking around is that they're going to have a heart attack. I mean, that is the number one killer in the United States. So it's really not sort of worrying about something that you shouldn't worry about. It's actually taking action through your lifestyle and working with your doctor to do the things so that you reduce your risk and you don't end up one of these statistics.
I want to talk a little bit more about stents and bypass, but yeah, I mean, just the one statistic alone, I wish it grabbed more people's attention. But I think it's something like 1 every 36 to 40 seconds. As we've been talking like this, one after the other is having a heart attack. Clearly, conventional medicine is not doing it. So now we're talking about stents. You want to add on, you can, but let's get into stents a little bit more, why they're actually put in and what we can do to maybe avoid it. But go ahead.
So let me give you an analogy or like a perspective on this so it like jars people a little bit. So if 600,000 people a year die of a heart attack, let's just take a 747. It's got 300 people on it, okay? So 300 people, so 300 into 600,000 is 2,000, okay? Now what if every year 2,000 747s crashed and killed everyone? Okay, so that's like 7 times a day, roughly. A 747 crashed. How many people would get on an airplane and fly to New York or Houston or Memphis if 7 times a day, 300 people went down in a plane and died? Well, I wouldn't get on that plane.
What you're talking about clearly illustrates, as crazy as this sounds, this part of our conversation, we are not, as a society, we're not taking this serious enough yet, and we're not being with enough integrity yet, and I am putting us more on conventional medicine, to admit that things need to dramatically change because we're doing the wrong thing for years.
That's right. That's right. Because that number's not going down. You know, it's not really changing. If cardiovascular normal prevention was happening, then that number should be going down. And it really isn't going down.
And to be clear, this plaque that's developing, again, to really hit home for people, don't get distracted. The plaque is developing not for the simplistic reason, oh, you eat fat, or oh, it's genetic, or oh, it's because you're aging, right? Because we've talked about this a little bit before too.
Right.
It's not just aging, it's not just fat. It's understanding that your body is, and correct me if I'm wrong, is recognizing a toxicity enough of the time, for a long enough period of time,
Right.
that it feels the need to develop this plaque.
Right. It's trying to handle a problem. And it's handling, unfortunately, over time, if the problem doesn't go away, why do people with root canals have 530% more heart attacks? Because it's a chronic bacteria hit the inner wall of the artery, cause damage. And there's even a study in another one of the cardiology literatures. They took men that had had fatal heart attacks who had root canal teeth. And at autopsy, they looked at the bacteria that were coming out of the teeth and the bacteria that were in the clot that killed the guy. And over 70% of the time, it was the same bacteria.
But doesn't it just make you shake your head when you hear, oh, correlation is not cause? They always want to downplay this very significant data that you just said.
Right. Right. But then they say lower your cholesterol and take the medicine because it's going to help you. And there's no cause-effect relationship of taking cholesterol drugs and reducing heart attacks or reducing deaths.
So just talking about stents just a little bit more, I'm just curious, I mean, from all your experience,
Yep.
if somebody does out there have one, God forbid, two or three, whatever,
Yep.
can they get removed? Can you actually get to the point where a person doesn't need them and can really completely heal? Or how do you answer somebody like that wondering about it?
Yeah, it's a sort of a spring-loaded thing, so you can't go in there and pull them out. But what you want to make sure of is that the disease process is reduced, so further inflammation, which can also precipitate clots, is reduced, and then that person has a lowered risk of having a heart attack. Again,
So is it a tricky
like we
thing
know,
to-
just an example. We haven't talked about this yet, but there was a large study from the University of Miami looking at diabetics that had had heart attacks in the past, and what happened if they put them on chelation. Now, chelation is a process where you give a medication intravenously to bind up heavy metals, lead, arsenic, mercury, calcium if it's in the wrong place. And they found that the guys who did that had very much reduced new heart attacks compared to guys who didn't get it. And that's really important because if you change the disease process, then the guy who survived it and got a medical intervention that saved his life has less likely to go through the same thing again.
But when we're talking to those people out there who have the stents, they're on blood thinners now, or they get a bypass. Maybe you
Right.
want to talk to those people as well. Is it that they have to stay on medications and do these other lifestyle changes? And what's your experience been like with people who are already, deep into this now and have had these procedures done?
Well, if they're looking for a better answer, they're taking a beta blocker because the cardiologist doesn't want their heart to beat too hard. And now they can't get an erection, or they're tired all the time, or their thyroid function goes low. And they're feeling like life is sort of in a ruined state based on the treatment that I'm getting. Some of those people will have an epiphany and they'll be like, maybe there's a better answer. And can you help me? So if they end up at my office, can you help me with this? And usually the answer is, yeah, let's get these other factors under control. And then maybe you don't need the blood thinner and the beta blocker and the calcium channel blocker and the ACE inhibitor. Maybe you don't need this stuff because now your blood pressure's good and your blood is naturally thin from the nutritional standpoint that we're doing, and your body can then run itself the way it's supposed to.
And when it comes to the plaque and what's happening inside somebody's cardiovascular system, they're all at risk for all these infections. Now I'm thinking about the person that does have that stent put in there. There's a risk of infection. How important in general, even though it seems like it's not related, that you make sure a person is aware of how they're taking care of their whole body to keep the risk of infections down. Because even conventionally speaking, they're saying, oh yes, the cause of heart infections, bacteria, viruses, and parasites. Okay, great. So they're admitting that this stuff is out there and it can hurt your heart. So how important is it to really test and make sure that the person is doing okay in these other ways so that they're not injuring their cardiovascular system even more and triggering more plaque to be developed because they have these raging infections in their body, besides what's coming from their mouth?
Their mouth, their gut, their metals, their high homocysteine, their high insulin, their high fibrinogen. What is, these things that cause the disease in the first place left untouched because usually the medication that's given isn't going to address these things. And then, or like some diabetics, the mainstream diabetic medicines actually increase the risk of plaque development by about twofold. So yes, it may help your blood sugar a little bit. It may reduce your insulin a little bit, but you get a side effect from the drug, which is 2 times more plaque or development than without the drug. But it's not addressed at all. So these are things that the person who's looking for a real solution so they can optimize their health and their longevity has to really kind of be a student or find a doctor who's looking at it and say, yeah, right now you need all this stuff. But if we can get you down this road, we can take this stuff off. And then the risk factors go down.
And so again, people out there who, again, might not think that this is such a big deal, but they have the plaque, they are concerned about their cardiovascular system, and they have a white tongue, they have yeast problems, Lyme, Epstein-Barr. There are a lot of these other infections, right, that if people knew how serious this was, causes so much systemic inflammation, does increase the risk of plaque to build up because it's hitting your cardiovascular system. It's important, as you say, to kind of calm down these fires so that you feel a lot better.
Right.
Next up, I'd like you to meet Dr. Cynthia Foster with some life-saving news about plaque. For example, let me ask you something. Do you think cholesterol is the reason why plaque develops in the first place? Well, Dr. Foster will reveal a surprising truth about plaque and how to get rid of it very quickly. In addition, as you know, removing excess plaque from the arteries can be a lifesaver. So Dr. Foster offers her comprehensive protocol for clearing away blockages inside your gut, liver, and bloodstream. And finally, don't miss Dr. Foster's urgent message for every person with high cholesterol levels and the best non-toxic remedies to achieve positive results. So, obviously a very important topic, plaque. A lot of people out there I know already get it. Having plaque is not a good thing, but conventionally speaking, I think a lot of people kind of hear a very shallow point of view. Plaque is mostly just about cholesterol. Cholesterol is a very bad thing. Avoid all cholesterol. And of course, conventional cardiology, take the statin drugs, the cholesterol-lowering medication. And the lower your cholesterol can be, the better off you are to avoid any kind of heart problems. That's what a lot of people are being told. This is the story that's out there, Dr. Foster. What's wrong with it? What else do we need to think about?
Okay, well, first of all, cholesterol is not necessarily a bad thing. Your body needs cholesterol in order to produce your hormones. So your testosterone, your progesterone, your estrogen. If you don't have enough cholesterol in your body, you will not make hormones. You'll get hormonal weakness. Sometimes I see vegans who've lost their menstrual period, women that have lost their periods because they're on a vegan diet. They're not getting enough cholesterol. So a certain amount of cholesterol is okay. The problem is when the cholesterol builds up in your body, okay? So, and once it's built up, the next thing that happens, if you're not eating correctly, if you have certain lifestyle factors, then that cholesterol starts to deteriorate, oxidize, and turn into plaque. And once it deteriorates, then it turns into a clot. Now, once you've got a clot, then you've got blocks, let's say in the coronary arteries, you've got a heart attack. All right, so that's why this is so important. Or if you have clots and cholesterol accumulation in your carotid arteries here on either side of your neck, then you're going to have mini strokes, TIAs, massive strokes, and those are such serious consequences that that's their answer. So that's modern medicine's answer to this buildup and this deterioration and the clotting. And we've kind of been talking about some reasons why these things build up. And I know when we did liver cleansing, the liver docu class that I talked about, it's about your liver and it's about your thyroid. So if you have accumulated lots of fat, lots of gallstones in your liver, then your liver's not going to be as good as at processing the cholesterol. So instead of looking at, oh, cholesterol is bad, we maybe need to start asking this question of how is the cholesterol in your body being used? How is it being transported? How is it being utilized, right? And so if we have healthy cholesterol in your body that does not oxidize, if you're getting good antioxidants in your body and you stop that oxidation process, If you have good nutrition so that the arterial walls are strong instead of malnourished arterial walls, which would weaken. So some people liken this process, this whole plaque formation, to scurvy. And they say that a lot of the symptoms of this are just like scurvy. And vitamin C is an important component of your arterial walls. Without vitamin C, you can't do the final cross-linking of the collagen, which is a component of your arterial walls. So if you have weak walls, you're going to have bulging. You're going to have the cholesterol start to deteriorate. You're going to get the blood clots. You're going to get the blockages. So what do we do about this, right? So we've gone into some of the causes. Do you want to take cholesterol-lowering medication? Will that stop this process? I think the research has basically said, no, not necessarily. People still have heart attacks, even though they're on cholesterol-lowering medication. People still have strokes. I mean, it's amazing. When I see people and they've already had a heart attack and they were already on that medication, it's like, well, it wasn't doing what it's supposed to do. It wasn't working very well. So now we've come to what are the underlying factors. One of the things that I will do, because sometimes people come to me at such a late stage, is I'll try to clear it out as fast as possible. The fastest way you can clear out this accumulation is to do a juice fast. So when I say juice fast, I have a certain way that I do it. So I won't let people do a juice fast without a colon cleanse, because you are getting toxins out of the body. So you have all of this excess, right? And we need to move out the excess, which is what your body's supposed to do anyway. Your body is supposed to take the cholesterol, transport it to where it needs to go, and then take it back, right? And then there's a whole recycling process that happens between the gut and the liver. And so if we look at this way of how cholesterol is processed, it's more important than just looking at the numbers too high. So now we're looking at how do we make this whole process more efficient? How do we make the liver more efficient so that when the liver makes the cholesterol, it goes into the right kinds of cholesterol, the right amount of HDL is produced, and the right LDL is produced. So enough cholesterol goes to the places where it needs to go to make hormones, and cholesterol is also a component of your cell walls. So every single cell in your body, the trillions of cells that are in your body, they are all lined on the outside with cholesterol. So we call it the lipid bilayer, right? So if you don't have any cholesterol at all, how are you going to make the cells in your body? This is a very important function of cholesterol. So we try not to think of cholesterol so much as the enemy as it is with how do we make this a more efficient process and how your body deals with cholesterol. So what do? We clean out the liver. I will give blood cleansing herbs. We'll do the juice fast. The blood cleansing herbs, chaparral, burdock, yellow dock, red clover. I love red clover for cleaning out the blood. And then I'll do liver cleansing. So we get the liver cleaned out. We flush out all the fat globules, all the pre-gallstones, all the gallstones, and there can be hundreds. How is your liver supposed to do this very important job of regulating cholesterol when it's stuffed full of sludge and stones, right? And that's where this is happening. So when I was in medical school, they were teaching me cholesterol is all about the liver. And it's a little bit about the thyroid too, when you have low thyroid. And now they're giving a drug that interrupts the liver from producing cholesterol. And what happens? They put a chemical with it. It's their patented medication. And the liver goes in and does damage. And now you get fatty liver going on from the damage. Okay, so this whole process should have been about healing the liver, and instead we're interrupting the liver and we're damaging the liver. And all to get a number. We're getting a number that looks good on paper and that doesn't translate into a good outcome because people are still having heart attacks and strokes. And so what do we do differently? We do the liver cleansing, the blood cleansing, and the herbs will help your body to release the excess. And then I always help people with their thyroid. Okay, so I give herbs that will support their thyroid function because, again, even though a person's taking medication, it doesn't mean that the problem is solved. So I have a lot of people that think their thyroid problem is solved because the number looks good on paper. They're like, I have normal thyroid tests, and yet they've got this process going on, or they've got the coarse hair, they've got the depression, they've got constipation, even though on paper their thyroid hormone levels look normal. So if that person were to develop the cholesterol plaque and all of that, then I would say, okay, not only do we need to clean out the liver and the blood with herbs, but we also need to take care of the thyroid problem. How fast could we clean this stuff out? So I had a patient that was probably 90% blocked on both sides in the carotids. And I said, that's kind of dangerous. And so that's when we go into healing fast. We go into how fast can we heal this? And I said, can you do a juice fast? Can you drink anywhere from like 2 quarts to a gallon of liquid every day? The more the better, and you shouldn't be starving. You're doing the colon cleansing herbs with it. You have to make sure what's accumulated comes out, right? So we're getting the cholesterol to come through. There's a colon formula with psyllium and bentonite clay and charcoal and pectin, and a lot of this stuff absorbs those cholesterol residues so that they're not recirculating back to the liver. So we're getting it at the gut level, we're getting it at the liver level. We're actually healing the liver, right? So the liver formulas, mine have milk thistle in it, and milk thistle is a classic for protecting the liver, right? So we're not hurting the liver with a chemical, we're protecting it so that over the long term, your liver can process the cholesterol correctly. That cholesterol can go out where it needs to go and come back so that it doesn't build up. There are also some theories that if the arterial walls are weakened, if they're not strong, that's why we collect the cholesterol there, because it's a protection. There's also some doctors that say you've been exposed to chemicals and this is your body's protective mechanism. It's protecting your blood vessels from damage, and we should always assume that your body's trying to protect itself. We should always assume that your body's trying to heal itself. So we don't want to put too many chemicals on board when you have a buildup like this. You can take you can take a knife, you can take a scalpel, you can cut that stuff out of the coronary arteries, but this is going on all over. It's going on all over your body. How are you going to clean the rest of it out? And just because you cleaned this part out doesn't mean it's not going to circulate from the other parts of your body, and that's going to fill up again, which is what we see happens. When I was learning about angioplasty during my medical training, they were saying every 10 years they're going to need another one. And eventually it's going to get to the point where we have to crack their chest open and do the CABG or the open heart surgery. And I'm like, wow, so that means that in the short term, you've solved the problem, right? You've solved the problem because now the coronary arteries are open, but you didn't take care of what were the causative factors, what was causing that to happen, right? So when you do the juice fasting, and I'll give them the blood and the liver cleansing herbs, and this lady with the 90% blockage, she cleared out in 1 month, completely cleared out. It was done. They retested her. It was negative. What you don't want to do is put oxidants in your system. Do not smoke if you have this problem. Every person I know that has smoked has damaged their arterial walls. It's arterial damage. They have phlebitis, they have aneurysms, they have cholesterol buildup. This is the absolute worst thing that you can do for your arteries, and it will make it worse. Should you take the statins? I always tell people, even if it's genetic, try to do it naturally. And you can always get retested. You can see how well it worked. But we can clear it out fast, and then the rest of it is diet and lifestyle. You have to make sure that you're following a healthy diet and lifestyle so that you don't get all of this buildup that happens again because you're overloading your liver with too much fat, too much, the huge steak, that a lot of people will have without any fiber with it. So that's very important. She cleared out, all of the symptoms went away. She had passed out because she wasn't getting enough. She wasn't getting enough blood to her brain. So all of that can clear out, and then the rest is about rebuilding the arteries and making sure you have good nutrition, and then you will be fine. Statins can increase your risk of Parkinson's. So, and it can also cause muscle damage. So if you care about your muscles, if you care about walking, if you care about exercising, then you should care about how you treat your liver. It's very, very important.
Dr. Foster, let me jump in for a second and ask your take on this, all right? Because I think some of the stuff you just said towards the end was almost like you were reading my mind. I've been hearing a lot from integrative healthcare providers how the idea that, again, Western medicine is saying plaque is bad, which in truth it is, okay, but never talking about why. I think most people understand that now too, easily. That the plaque is there for a good reason. This is the part that conventional cardiology never speaks about. Putting the person into that mindset right away if they were told, the plaque is going there to patch up and to protect you. What a crazy notion that most people are never told. I just want to get your take on that. That it's the toxicity, it's the things you are addressing, stuff to avoid, stuff to take in. If all of that over time, in a very short period of time, could have a major difference on taking away the need for the plaque to go there in the first place, and then the person has an opportunity to really, literally, clear out their arteries and feel such a better circulation. Is that your experience?
Yes, yes, and also when you take lots of antioxidants, and foods are, good organic foods and plant foods are very high in antioxidants, and so when you consume those, you are having an antioxidant effect on your arteries and on that cholesterol. So, and the other thing I'd like to add is if you're being exposed to a toxic chemical, stop. Like, stop it. Do you work in a chemical factory? Do you work in a dry cleaners where they're using toxic chemicals, where your body may be protecting itself this way from those chemicals? Because everything you're exposed to is going through your blood, right? So, and hey, that bloodstream is very important, because if you don't have that, you're not alive. You won't survive.
So as we wrap up, Dr. Foster, for those that do have right now excessive levels of cholesterol, what are some other things that they can just start introducing into their diet? Is it drink and supplementation, or some foods, herbs, spices, just some fun things that they can start moving into their life every single day that really are hitting to their point, right? Trying to calm down the excess cholesterol and get them going in a good direction.
Probably the easiest thing to incorporate in your diet if you have high cholesterol is garlic. Garlic is one of the most highly researched herbs on the planet. When I was in medical school looking to see if there was any information on herbs, I scoured the medical school library and I found one book. They had one book there, and it was all on garlic. It was the hundreds and hundreds of research studies that had been done on garlic, how it lowers your blood sugar, how it lowers your cholesterol, how it kills bacteria, viruses, fungus, parasites, blood pressure, lowers your blood pressure. And so if you were to incorporate one food into your diet, it would be, I would tell you, have garlic, put it in hummus, put it in your pasta, have some raw. There's aged garlic, there's fresh garlic. I always tell people that raw is stronger than the cooked if you're killing an infection, or if you really want it to do a lot of things. But use garlic. Foods that are friendly to your liver, all the greens. All the greens help your liver to produce bile. You want to help the liver produce as much bile as you can, because bile is what transports the cholesterol, which helps your body to metabolize the cholesterol. So salads are very important. A dandelion salad would be optimal. Any dark leafy green. If you don't like salad, chop it up really fine. If you don't like greens, maybe put it in a smoothie or a juice. mix it with a little apple, make it taste good. There are ways to incorporate this stuff so that it's enjoyable, so that it's fun. I mean, my whole thing is, let's make this whole program enjoyable because it's a long-term thing. It's a lifestyle. And if you follow this lifestyle, then you'll be fine. You'll be like, why are my friends around me sick, but I'm doing well? And it's just, it's these things that we do with our diet. It's avoiding fried foods. It's not having trans fats. It's avoiding the white flour. It's avoiding all the sugar. There are a lot of experts that say it's the sugar that caused all of the heart attacks, that had nothing to do with cholesterol, and that because of these huge corporate lobbies, they said, oh, it's the cholesterol, but it was actually when we introduced white sugar into the American diet that this happened, that this is a food that's been stripped of its B vitamins, that causes blood sugar highs and lows, that causes over the long term diabetes, and weakened arterial walls and things like this as well. The whole body gets weak when you eat those processed foods. So if you learn what to eat instead, have the whole grains instead. The fiber helps to eliminate excess cholesterol. So make sure that you have fiber. Make sure that your colon is moving. A lot of people are fine with that, but I sometimes talk to people who have a bowel movement once a week, once every 2 weeks. How is your body going to get rid of the excess cholesterol if you're not having bowel movements? Because this is the way your body eliminates waste. It's the number one way that your body eliminates waste. So it's very important to do that. So as much as you can do to make sure that your colon's moving, maybe it's probiotics. I like coconut milk yogurt. I like that a lot. Anything that's cultured, I like that as well. There's herbs that help your colon move. Cascara sagrada, senna, those things as well. Miso is great. All of those factors are important when you're looking at this problem, and they're pretty easy once you know how to do them.
I think a simple thing that popped into my head as you were talking is this idea that an anti-inflammatory diet lifestyle is really an anti-plaque lifestyle. It's really that simple. Have lots of antioxidants. Have your protective type substances flowing in your body as much as you can. We're not trying to judge anybody if they have a little sugar once in a while. We're trying to keep it on the ground and be well balanced about this. If you're eating lots of sugars, if you're dehydrated, if you have a lot of toxicity, if you're taking medications, the scale is tipping in the direction of a pro-inflammatory lifestyle that is more conducive. What I'm getting from you, correct me if I'm wrong, is more conducive to producing more cholesterol, having more plaque in your body, your blood is getting more sluggish, everything's starting to get clogged up, and now we want to lean more towards an anti-inflammatory lifestyle, promoting circulation. One last thing as we close out that I thought was really interesting, and I'd like you to highlight it, maybe make it clear for people. The idea that if your gut is clogged up, and you're doing all this liver stuff, which you said before, which I thought was great, but if your gut is clogged up, then isn't there a communication problem? The gut is going to be clogged. The liver, you're kind of saying, well, let's go, all these herbs, clean it out. But the liver's going to be like, I can't do it because you're all clogged up in the gut. So it's important for people to understand this whole relationship, right?
Right. I always unclog the bowel first. You always do the bowel cleansing first, or if they're in a rush, I do them both at the same time. But yes, if you try to do a detox program, if you try to clean out a bunch of cholesterol and your colon's not moving, it's going to be a disaster and you're going to feel badly. And then you're going to think, like so many people, that you're having an allergic reaction to an herb, and that's not what's going on. You're having a healing crisis because your colon's backed up and you're releasing toxins and they're not coming out. So that's one of the first things I do when I explain to people herbal reactions. Most are not reactions. Most are you took herbs in the incorrect way, in the wrong order. And I always say gut first. Gut is always first, even if you have a brain problem. There was some kind of research study I remember reading, and it was in an emergency room journal, and it had to do with their studies on charcoal. And what they found out was if they gave the activated charcoal, then they noticed that these poisons a person had been exposed to, right? So these are people that came into the ER with chemical poisoning or whatever. They gave the charcoal through the gut, and they found that these poisons actually migrated towards the gut. Once you get the gut cleaned out, the rest of the body is going to dump, right? And so it's always number one. You always clean out the gut first. If you respect the way your body works, then your cleanses, your detoxifying is going to be so much easier. You're going to be one of those people who feels fine during a cleanse.
And just to be really clear, right, what you had mentioned very quickly before, it isn't all right for someone to feel terrible and think that that's part of their healing process, right? It gets like it's important for people to understand. If there's a mobilization of toxins and they're not getting them out, they could really produce a world of hurt for themselves, right?
Okay, so you don't have to do a cleanse perfectly the way it's written out. It's more important for you to respect how your body is responding to the cleanse. And if you do that, you're respecting your body's wisdom. And that's generally like when we see the best results anyway. It's by not forcing and pushing. It's by respecting what your body's trying to do. Your body knows how to do it. If you just understand that, my body wants to heal, my body knows how to do it, then the rest is just going with it and following your intuition.
I hope you enjoyed day 2 of the Cardiovascular Doctor class. We're just getting started, and I know you'll be amazed at what you'll discover in the coming days. Please help us to get the word out about this event by sharing this link with family and friends. I look forward to talking to you again soon. Take care.